on the counseling as a profession and effective practices. I hope that you have been enjoying for the past 2.5 days. The program was really has brought a kind of changes in you, and this is the penultimate
Hello. So sorry for that internet connectivity problem. Dr. Kannan. Kannan. Yes, sir. Oh, sorry, sir. Sorry, there is a kind of internet connectivity problem here in the university. So sorry for that, dear participants. Sorry for that. Some kind of the internet connectivity problem in the university. So it will be set right in another 10 minutes. Kindly bear with us. Before that, I'm just happy privilege in introducing Dr. M. Kannan, the Director Research, MS Chellamudu Trust, and the principal of the former principal of Madurai Institute of Social Science, and he did his MSW, MA Social Work from Madurai Kamaraj University, MPhil from Tata Institute of Social Sciences, Mumbai, PhD from Madurai Kamaraj University, and he has a lot of PhD diplomas to his credit. And a brief profile about Dr. Kannan. His area of interest is research, training, and counseling. Currently serving as an assistant state nodal officer, Tamil Nadu Police Wellbeing, a research guide for PhD scholars at Madurai Kamarajan University, Nalahapa University, and produced 3 PhD scholars and more than 28 MPhil scholars. As a research coordinator, he involved himself in many research projects, national level, state level, regional level, and local level, and presented more than 180 papers in various international, national, and regional and local conferences. And he has been a state coordinator for organizing various educational programs by Dinamala, the national Tamil dailies, providing consultant services for more than 750 people, and conducting soft skill programs for the school teachers, industrial and students, and serving as honorary research consultant for more than 25 NGOs. And our Dr. Kannan is not new to the Department of Social Work, and he has already dealt with the scaling techniques during the webinar on the research methodology. And today, a very important area is on a psychometric test that is involved in the counseling. Now I request Dr. Kannan to handle the session on the psychometric test in the counseling. It's over to you, sir. So once again, we regret for the technical glitches. Thank you.
Your skin முதல்ல இருக்கும் First, you were there. You open a killer. You know, PPT open. PPT open. Share the PPT. Slides over. You were presenting to everyone. You are presenting everyone. Stop. Second, you want. Very good evening. Can you all hear me, ladies and gentlemen?
Yes, sir. Yes, sir.
Yes, we can hear you.
I'll try to show my PPT. I'm not able to see any one of you. Okay, then I'll proceed further. If you have any problem, kindly you just inform me. Okay. Can I proceed further?
No, the PPT is not visible, sir.
1 minute, I'll try to. Slideshow from the beginning. I'll take. Can you see now? Hello?
Not yet. Not yet, sir.
Okay, I'll do.
Okay, sir.
Yes, sir. We are able to see your PPT. Yeah. Now now we are able to see all
Yes,
with
sir.
your PPT.
Okay, right. Thank you. I'll.
But kindly put it as a slideshow. Full, sir. Kindly put it in a slideshow.
Is it okay
Yeah.
now?
Yes, sir. Yeah. Fine, sir.
Good evening, ladies and gentlemen. I'm very happy to associate myself with the Department of Social Work, Parthasarathy University, Tiruchirappalli. I think this is my second presentation for this department. I'm so happy and I'm thankful to Dr. Ilango, Dr. Mangleshwaran, Dr. Jerida, all other faculty members, research scholars of this department. Well, the topic for today's discussion is psychometric test in counseling. Yesterday and day before yesterday, you were all listening to various experts' views on counseling. But I would like to focus on various tests, psychometric tests, which will be useful in the field of counseling. This is what I am, and Dr. Mangal was very kind enough to explain about my status of today. The present scenario till 2019, we were telling that stay away from negative people. And from 2020 onwards, we say stay away from positive people. Here, positive means corona positive. I must really appreciate the department because when the whole world is in lockdown, continuously the Department of Social Work, Parthasarathy University is organizing various kinds of webinar, and it gives it's immense pleasure to associate ourselves with the Department of Social Work. Now, the topic is psychometric test in counseling. First of all, let us discuss the different settings for counseling or different counseling services. I hope I am audible, I am very clear. Am I?
Yes, sir. Yes, sir. Yes, sir. Very clear.
Thank you. As you know, the last presentation itself, I told I'm not able to see your faces. Nevertheless, I am seeing my own PPT and talking to you. Okay. Well, there are twin organizations in Madurai. One is Chellamuthur Trust and Research Foundation, and second one is Ahana Hospitals. These are the twin organizations wherein they promote different kinds of counselors, psychotherapists, psychologists, psychiatrists. Okay, these are the twin organizations. Chellamuthur Trust and Research Foundation is headed by Dr. C. Ramasubramanian. We shortly call him as Dr. CRS. And Ahana Hospital, the young energetic person, Dr. Vikram. They are handling these two organizations, rather they are taking the limelight of this world. Okay. Now let me focus on different settings. Then I'll come to the different psychometric tests. The first center we have is Center for Psychiatric Rehabilitation. Around 300 bedded hospitals we have, or rehabilitation center we have. We have a Shrishti, a short-term care center, Retreat, long-term care center, Bodhi, mental health training and research center, home for the mentally ill, rather home for wandering, homeless, mentally disabled. So this is the first one called Center for Psychiatric Rehabilitation. Second setting is Center for Persons with Mental Retardation. Roughly around 100 persons are getting benefits of this center, through this center. One is Akash, a special school for special children, rehabilitation home for adult persons, both men and women. Then Vriksha, rehabilitation home for the adult MR women. So this is second center that we have. The third center is Center for Vocational Rehabilitation and Placement. 75 persons are getting benefit out of it. We have a printing press run by the mentally disabled. Most of them are mentally disabled and only few of them are normal persons. We have a Shakti, a printing press, and micro enterprises, handicrafts, etc. we produce, we manufacture. The fourth center is called Center for Rehabilitation for Persons Dependent on Alcohol and Drugs. We have a 30-bedded hospital, treatment center, de-addiction center, supported by Government of India, Ministry of Social Justice and Empowerment. We have Trishul, the name of the center is called Trishul, de-addiction and aftercare center. Then we have a community-based programs, program number 5, roughly around 1,500 persons. We have a community mental health project, a CMHP, supported by Angelic Hilborn, Germany, then Anaya, initiative of Delhi Psychiatry, then Rotary Blossom, Mission Mental Health, the joint initiative of Rotary International Districts, 3,000, 2,730, 5,430, and that trust. Joined together, we are working in 8 districts of Tamil Nadu, and we are doing mental health awareness, mental health treatment, etc. Then we have a support programs like Subisham, a caregivers network, then Synergy, siblings network, Share, mental health volunteers network, Speed for survivors of suicide loss, then Mental Health Advocacy, Center for Legal Assistance. Okay. Now, up to this, I was talking about the functions of Chellamuthur Trust and Research Foundation. We have Ahana hospitals. At 5 different places, we have Ahana hospitals, Madurai. It is a 130-bedded specialty hospital in neuropsychiatry, which take care of the medical management of the persons with mental illness. We are functioning as a team. Remember, my friends, It is very important, and I'm very proud to say that this is the only institution which has accommodated more than 30 psychologists, social workers. Okay, and our founder chairman, Dr. C. Ramasubramanian, shortly known as Dr. CRS, strongly believes that only the psychiatrist alone cannot treat the mentally ill or mentally disabled. It should be a combined and coordinated effort. So the words were taken by his son, Dr. Vikram, and we have Hahana hospitals, and we have a team of members like medical officers, psychiatrists, general and clinical psychologists, counselors, social workers, vocational instructors, play therapists, occupational therapists, physiotherapists, speech therapists, yoga therapists, special educators, significant family members. We also involve the family member in treatment, then psychiatric nurse. This is a team, and we work as a team. My dear friends, on every Friday we have a meeting to discuss various issues, and we function as a team. Okay. On every Friday we have a case conference, case discussion. Then we move on to like how do we do research activities. All these things will be taken care of. So we function as a team. Now I have just explained the various settings. Now I am reminded of Dr. Parthasarathy of NIMHANS, Bangalore. He's no more. He was my mentor. He's my mentor even now, I would say. And he has attended a conference. The conference was hosted by Ward number 12 of Mania Tilak Hospital, Sion, Bombay, in the year 1988. The title of the conference was National Colloquium on New Horizon in Social Work. Remember, my friends, it was organized by a social work ward of that particular hospital, not a college. Okay, many people from different walks of life throughout India, they have assembled, and we have conducted the conference colloquium, and I was also part of it. That time I was doing my MPhil in research medical sciences. I had an opportunity to attend the conference, the colloquium, where Dr. Parthasarathy said, talkers are talking and doers are doing. Unless talkers do and doers talk, the word development will be found only in dictionary, not in reality. And he mentioned that all the faculty members are talkers, meaning they take classes, they preach, sometimes they teach, mostly they preach. I'm sorry, Dr. Mangal, you shouldn't be offended. Most of the time we preach. Whatever we have learned, we are trying to share all the things in our classrooms. But there are another set of people who are really doing. They are called practitioners. They are doers. They are called doers. Now, Dr. Parthasarathy said, when talkers are doing and doers are talking, then only their word development will be in reality. Meaning that when I talk in the class, I should also do in the field. When some people are doing in the field as a counselor, okay, or therapist, they should also publish a lot of work so that it will be known to the academic world. So I think based on this dialogue, based on this idea, my friend Dr. Mangal, along with other faculty members, is organizing this 3-day webinar on counseling. Okay, once again I appreciate the department. Remember, you may be thinking why this fellow is appreciating all the time. Yesterday he came in the line and he started appreciating. Today also he came in the line and started appreciating. What the hell? You may be thinking, friends, please understand, when you are appreciating somebody, you are adding value to their lives. You are trying to give some meaning to their lives, and you are motivating indirectly, and thereby you are trying to extract more. If people are appreciating me now, probably I may try to deliver a lot. Okay, whatever I have, I am ready to share. This is what the magic of appreciation. Okay, so once again appreciate, and I like to record that I am not a counselor. Please understand. But I am conducting training program on counseling. What does that mean? My dear friends, understand, taking classes on or taking sessions on counseling is the easiest task. I may explain with a lot of examples on how to give responses like evaluative responses, interpretative responses, probing responses, supportive responses, or understanding responses. These are called the counseling responses. I may articulate very nicely And I may give a lot of examples. I can even dramatize how a counselor should act. But when I am thrown into the reality world, that is in the counseling session, I do not know whether I will be a successful counselor or not. That is why I like to appreciate all the counselors who are really struggling each and every nerve, straining each and every nerve of themselves, and they are trying to help others, and who others meaning those who have a lot of psychosocial problems. And at present, the whole world is talking about coronavirus. In spite of it, today we have initiated a program called the Post-Test Counseling Center. Madurai Corporation, we have a control room wherein we have been talking to the people who are affected because of corona. The counselors who are trained and who are working in ICTC, Integrated Counseling and Testing Centers, where most of our social work students are working, they have been invited. Yesterday we've been there. The day before yesterday we've been there. Dr. C. Ramasubramanian and myself, and along with my friend Dr. Guru Bharati, who also took class on counseling process, we have conducted a training program on counseling the COVID-19 patients or persons. So today, the Minister, Honorable Minister for Revenue, Disaster Management and Information Technology, who is also a professionally trained social worker, Thiru R.B. Udayakumar, and another minister called Mr. Selvu Raju, Commissioner, Collector, all of us, we have initiated a center, we have inaugurated a center called Post-Test Counseling Center for COVID-19. What I'm trying to tell you, it is a very difficult task to provide counseling. One needs to have a patience. One needs to understand empathetically the conditions of the client. It is very easy to talk over mind, but very difficult to practice. So my friends, I'm trying to explain how all these psychometric tests can be used when we are providing counseling. When we provide counseling to the client system, we understand their problems, and we have to say empathetically that we have understood the problem, the way in which they have understood. Okay? Then we make them to talk more, and we elicit more facts and feelings. Remember, when you are trying to probe, there are two important things I need not to say about it. One is called fact probing, another one is feeling probing. We are not more worried about the facts. What is their age? When they got married? No, we don't want. Of course, we want for our record purpose, but we should have more knowledge about the feeling component. Okay. Of course, we need to verify the validity of the information. Yes, we should believe. We should accept the person as they are, and we have to validate the information that we are obtaining from them. We offer various types of counseling services to them after we listen to them. Over a period of time, we would like to have, we would have got a lot of both qualitative and quantitative data. What is that we are going to do with the data? Now we have to check whether we have collected the relevant or authenticated data. Right? What do we do with the data? Are we still keeping it in the diary of the case records? Now, these are the questions that had come in my mind, and that is why I requested Dr. Mangal to give me a topic on how can we apply psychometric test. But remember, the counselors, those who have got the social work background, are slightly different than counselors who have got the psychology background. I think Dr. Kadaravan of Salem Bharathiar University, Periyar University would have explained various components and role of psychologists. Now, my aim of this presentation is whether you are having psychology background or social background, whether you are a professionally trained counselor or not, these are the techniques, instruments available wherein you can get a lot of training, and you can also try to adopt all these instruments when you are providing counseling. Okay, so this is the aim of this presentation. When you say type test or psychological psychometric test, there are different types. Okay, there can be many sources and types of tests. Number one, tools drawn from internet. If you log on to any internet website, ResearchGate or anything, you can download a lot of instruments. Now, tools prepared and published by other persons, like I think you know, National Psychological Corporation of India, where they have got many number of scales, standardized scales they have published. And the next one is tools constructed and validated by us or the practitioners. Okay, these are the different three types. But a word of caution, this slide I have shown when I was talking about attitude scale construction itself. Whenever you are trying to adopt any instrument, keeping in your mind that the collected data should be published. If you have that idea, remember, my dear friends, all this information which I am projecting on the slide, you should have collected it. Number one, the author, followed by year, complete reference in the required format, whether you are following APA style, American Psychological Association, or any other style, Vancouver style, or any style. Or if you are a student of social work, you have to follow the methodology, bibliography, references suggested by Indian Journal of Social Work, published from Tata Social Sciences, Mumbai. Then subdomains, do you have any subdomains? Then number of items for each domain. List of positive, negative items, scoring procedure, meaning for the score, reliability, validity, and norms for the group. Okay, these are the things that you have got. Now, when you are administering a tool, psychometric tool for your client's population, if you have cross-checked all these things, and you can have two things. Number one, you can do your counseling process nicely, and number two, you can also publish a nice research article in a leading Scopus journal or more impact factor journal. Therefore, my request is identify relevant construct of your work. When you are doing a counseling, you would have got a lot of constructs. Okay, then define operationally by using review of literature. Then identify the domains of the construct chosen. Construct the draft scale. Use any one of the methods, like Likert methods or Thurston's method, any method as you wish, or as you have confidence on that. Then validate the scale using advanced statistical techniques. Publish it in a leading scientific journal, and please do not depend upon the scales developed by the foreigners. And if you want to depend upon, learn thoroughly the psychometric properties of the scale. Okay, now coming to the various tests. Friends, in the beginning of my lecture or my presentation, I have talked about various centers. Please remember, my dear friends, all the viewers, please understand, we have different centers in Vimachala Trust and Research Foundation. We have Ahana hospitals. In all the centers, whatever the kind of psychometric test that I'm going to project or I'm going to tell you, we are following, because we have a team of members and we offer training before we are administering it, and we are doing all these type of testings, and that is why we're very confidently projecting all this. Number one, mini mental state examination, MMSC. When you want to assess the delirium or confused state or pre-evaluation for dementia, you can go for mini mental state examination. My dear friends, I think some of you or most of you are aware of all the things, but then I'm just recollecting or recapitulating various psychometric tests. It should be done very scientifically and systematically. Then only you can do very nice counseling, as well as you can publish your research work or publish the work in the form of research. Second one is SLD, Niemann Specific Learning Disability Scale. Well, when somebody is having average IQ but lack in academic, or we can also identify the juvenile delinquents, and sometimes you may also identify the high creators and thinkers by using SLD, prepared by Niemann's Specific Learning Disability Scale. Then behavioral problems, we have a CBC, CBCL, that is Child Behavior Checklist, and you can administer that also. Friends, I'm just giving different scales, and depending upon the population in which you are working, you can identify the instruments and you can do that. What's that in the time? You are no longer presenting. Am I audible, Dr. Mangal? Is it okay? Because somebody,
yes, sir.
because in
Actually,
the chat,
yes,
somebody,
sir, yeah, it's very clear. Maybe there might be some problem with their internet thing.
okay.
I think so.
Can I proceed?
Yeah, but as of now, I am very clear. Even right now, due to the technical reason, I am hearing from the mobile. It is very clear. But maybe kindly, dear participant, kindly check your internet connectivity or a speaker. But the audible is clear. Yeah. Yeah, please go ahead, sir.
Dr. Mangal,
Yeah.
you are repeatedly telling that you are very clear. Tell me when you were not clear. Okay.
Okay, fine.
Okay, on the right. Thank you.
Yeah.
Memory. Next one is to test the memory. We have PGI memory scale, then Westless memory scale. All these things are very much available. Okay. Now next one is projective assessment. Second area is projective assessment. We have a TAT, thematic apperception test, to know the interpersonal conflict and inner psychic process. So we can do thematic apperception test. We have children apperception test, CAT. The neuropsychological assessments demands a battery for neuropsychological profile for adult and children. We have instruments. Okay, and if you can write to Niman's people, they'll supply or they'll give training. If some people are joining together, you're visiting to Niman's. They'll offer. They are conducting a lot of such training programs. Both the Department of Psychiatric Social Work as well as the Department of Clinical Psychology, they are offering such courses. Okay, then family and marital adjustment, dyadic adjustment scale, and Lockheed marital adjustment scale. These are all the projective assessment instruments. Then when we talk about stress and coping assessments, we have a perceived stress scale. And most of the PhD scholars, they are also using this scale. Then we have a dysfunctional attitude scale. There are 7 dysfunctional areas, right? 35 questions are there. Dysfunctional attitude scale, DAS scale is there. Then aptitude assessments for career assessment, to measure the interest, aptitude, personality, etc. Then some of the most interesting, popular instruments are David Battery of Differential Ability, DBDA, which has got 8 domains, and Holland's Interest and Skills Inventory. Okay, we also have a Thurston's Interest. I have not mentioned on the slide. Thurston's Interest scale. Okay, you can also use all these type of instruments. The next one is a psychodiagnostic profile. Friends. It is easy to say that you can use Rorschach's diagnostic profile, but then you need to have a clear-cut training. I think only the clinical psychologist can administer Rorschach's psychodynamic profile, and they only know the interpretation part of it. Okay. Then multiphasic questionnaire, like Minnesota multiphasic questionnaire is there, personality inventory is there. Then brief psychiatric rating scale, BPRS, which has got 21 items. I remember vaguely. Brief psychiatric rating scale is present. Then Altman self-rating scale for Mania, ASRM. Okay. Then Beck depression inventory, BDI. Okay. Remember, in Beck depression inventory, there are 2 important items which relates to your sleeping pattern and your dietary pattern. So when you have problem in that, immediately you have to consult a psychiatrist. That is an indication given by the Beck depression inventory. Then we have Beck anxiety inventory, BAI, okay, R&D Beck. Also, we have Hamilton anxiety rating scale, Hamilton depression rating scale, which I have not mentioned in the slide. Then Yale-Brown's obsessive compulsive scales, okay, Yale-Brown's obsessive compulsive scale. Next, psychodiagnostic profile continues. We have CAIGE, cutoff, annoyance, guilt, eye-opener, questionnaire for alcoholic dependence. Similarly, another instrument is called AUDIT, Alcohol Use Disorder Identification Test. It's a questionnaire for addiction. Then MAST, Mexican Alcoholism Screening Test for testing the level of addiction, alcohol addiction. We have some other instruments which are measuring the internet and social media addictions. Okay. Then panic disorder severity scale, Beck scale for suicidal ideation, state-tried anxiety inventory, Leoboy's social anxiety scale, positive negative symptoms scale. Job stress, then family burden by Pai and Kapoor, and family burden by SCARF, Schizophrenia Research Foundation, Chennai. Then knowledge and attitude to mental illness. We ourselves have standardized a scale on knowledge and attitude towards mental illness because we are offering mental health literacy to various people. And I would like to mention here that MHLM Trust and Research Foundation, in collaboration with HCL Foundation, we are offering Happy Schooling project for corporation school. Year before last year, the HCL Foundation, Madurai Corporation have given 10 corporation schools. We have worked, and the second phase, Corporation and HCL Foundation have given 14 additional schools. Right now, we are working with 24 corporation schools. And we can work with the teachers, problem children, even problem teachers, and headmasters, and administrators, parents. So we have got different types of audiences. Depending upon the need, we can also administer all the scales. So we offer happiness, we offer mental health literacy. For all these type of activities, we have developed our own instruments and we are administering it. In fact, the first phase, we have interviewed 1,773 students, right from 6th standard to 12th standard, and we have assessed their happiness level. We have assessed their resilience. Then we have assessed their knowledge about mental illness. We have assessed their guilt feeling, fear about exams, exam anxiety, all these things that we have assessed. And accordingly, we have planned for their betterment. Okay, intervention packages, intervention strategies have been prepared based on the findings of the study. That is why I said, as a counselor, if you are doing some work and if you are trying to explain what you are doing in the field, with the faculty members of different schools of social work, different schools of psychology, you can also enrich your knowledge. Okay, you can do collaborative work. Then we can also talk about work-life balance scale. Now, these are all the intellectual and cognitive assessment. I'm sure that these techniques or assessment should be done with the help of clinical psychologists only, because they are the one who are eligible to certify or provide or to offer certificates, and based on the certificate, the client may get some benefits from the Government of India or Government of Tamil Nadu. So Binay Kamat test, BKT, Alfred, Binay and Kamat, then Vineland social maturity scale, Raman's progressive matrices. Okay, it's very, very interesting to measure your IQ and other things. Wessler's adult performance intelligence scale, then Malin's intelligence scale for children, Bender visual motor Gesall test, Benton visual retention test, PGA memory scale, and Wessler's memory scale. Remember, all these scales are available, instruments are available. Okay, especially Raman's progressive matrices are also available in our center. We offer training to the people, whether they have studied psychology or not. Then we'll ask them to administer. Then it will be rated by an expert. What we do is inter-rater reliability will be, so certificate will be done only by the clinical psychologist. Friends, I have mentioned a lot of statistical tests. A lot of psychometric tests. It is up to you to decide which one you want to take. So once again, I'm very happy that Department of Social Work, Parthasarathy University has initiated the program. And I know I have very limited time, but then I wanted to convey my appreciation to the department. I like this slide. Everything is fine until you are not chosen. Okay, this is the current situation about Corona. Without thinking anything about Corona, the department is functioning. Okay, and 3 months of quarantine. I don't know whether the government is going to extend the lockdown, but then we were in 3 months of quarantine. Still, we had food on our table, no sick in the family. So we should thank the Lord Almighty. Whichever the Lord that you are worshipping, you please thank and say, you just show your gratitude to your family members and gratitude to your lovable God in any form, and say thanks to the Lord for not making me as a sick person and serving me for the people who are infected by Corona. Okay. Well, these are my mobile number or my email ID. Whenever somebody is having anything, friends, it is an open invitation from MHLM of the Trust and Research Foundation. Professor Guru Bharati has conveyed his regards to you, and he also asked me to pass on the message. Any person who is doing counseling and would like to have some exposure, you are most welcome to our Ahana hospitals, and you are most welcome to MHLM of the Trust and Research Foundation. Okay, we are ready to share our knowledges, because we know knowledge is power, and we also know that we live only once. I do not know about my past life or future life, but I know I'm living today. And the guiding philosophy of our trust is we live only once. If at all we have an opportunity to share something to the fellow being, let us do it right now. Let us not postpone it, because we do not know whether we'll get the chance again or not. So during this lockdown period, I have wonderful opportunity to move with the Department of Social Work, Parthasarathy University, and I didn't want to miss it. And that is why whatever little knowledge that I have, I'm just sharing. Okay. That's all, Your Honor. Thank you very much, ladies and gentlemen. I know you have a lot of questions, but then there is another speaker who is ready to continue. And in the beginning, there was a slight starting problem, and probably now it is all okay. And thank you once again, Dr. Mangal, Dr. Ilango, and all other Dr. Jarida, and all faculty members of the Department of Social Work for recognizing us in this lockdown period. Take care. We love you.
Thank you, sir. So thank you, Professor Kannan, sir. So it's a very wonderful session. As usual, the test and the scaling technique. I know whenever I think of any measurement, right? So I always think of that. I equate the measurement with Dr. Kannan. So naturally, I think you are the right person to talk, and I think you will be with us for some time, or you want to leave.
Well, I'll follow it, and if the corporation commissioner is giving a ring, I'll just move it. Okay. Otherwise, I think my
dear participant, kindly note of this. I think if at all any questions related, because I know that there is in between some technical issues has also happened. So I should thank Dr. Kannan, right, on behalf of the participants, for really elaborating on the various tests, right, the need for the psychometric test. And so my congratulations to you, sir, for taking up the post-test counseling center for COVID-19. I think this is the first initiative in Tamil Nadu, especially in Madurai. So my best wishes. I think I'm very happy that you, Dr. Professor Guru Bharati, and your team of Chelamuthuthas and Ahana Hospital has taken up this along with the government of Tamil Nadu. So the congratulations. I hope that in Trichy, if it happens in Trichy, definitely we will also coordinate for this program on the post-counseling. Yes, sir.
Dr. Mangal, as I told you previously, a couple of days ago, we'll talk to the Minister, Revenue and Disaster Management. He's a professionally trained social worker, Mr. R.B. Uday. We'll try to invite to Bharathidasan University, and social workers and psychologists, counselors can join together. We can have a session with him maybe after a few days, okay?
Yes, sir. Yes, sir. Thank you, sir. So thank you for joining us. So may I invite Mrs. Meera Ramesh. So the last but not the least, very important aspects where many of us were been asking in the chat box how we need to record our counseling or a case of practice. And so when I feel that this particular aspect can be covered only by Mrs. Meera, the psychologist from Atma Center. She is a consultant psychology at Atma Hospital Center for Mind Care. And she did her psychology and specialized in counseling and guidance, and she worked as a resource person for the Hindu for 3 years. Later she joined as an Atma Hospital, and now she is a counselor there. She is a Rotarian and a member of Advisory Club of Trichy University. She is an advisory to Mahila of Tamil Nadu Arya Vaishya Mahasabha, and she is a counselor in the family court. She contributes regularly in the article on mental health for Atma magazine. She is an editor of GML Rotary District 3000. She is a consultant psychologist for IIM Trichy. So these are a brief profile. Of course, very great personality we have with us, Meera Ramesh. So now it is over to Meera Ramesh for a session on the recordings in the council.
Good evening, sir. Hope I am audible to all over there.
Yeah, fine, madam. Yeah. Fine, yeah.
It is indeed a great pleasure to present before you and before Bharathasan University, and to be on this platform where all great doctors and speakers have been there. And for all the 3 days, it has been raining psychology and counseling, I should say. And we had a very blissful and a happy shower of getting into the minds of all those great speakers, knowing more about them. And I should thank Dr. Kandan, who spoke just before me, for having appreciated the role of counselors and psychologists, because indeed we do know that we are holding the lives of many when we are doing a counseling session. And sometimes it is not only with the person with whom we are speaking or with the person who has enrolled as a patient, but at times we have realized that we are holding the whole family in our hands. So with this few words, I would like to go into the history collection in patients. The beginning of every journey starts with the first step. So too, the beginning of any successful counseling starts with history collection. And as the saying goes, well begun is half done. A good collection of the data of the patient present before us matters a lot. I would like to go to the next, yeah. Coming to the first slide, we do require the basic information or the demographic details of the person whom we are handling. The basic information, I mean, the name, the age, the sex, the occupation, their address, and identification marks. It's very important for medico-legal purpose. And the informant who is accompanying the patient needs to be reliable. And the next one, when we take the patient, we do ask about the chief complaints. Now, the chief complaints has to be derived from the patient himself first, and later, the next slide follows, it will be from the attender who comes with the patient. You just need to ask the patient how his sleep pattern is, whether he suffers from sleep disturbance, how his appetite is, does he suffer from a poor appetite, or does he has an increased appetite. And sometimes the patient used to speak about their appearance. They used to say that they feel that their features are changing, they are becoming more short, they are not appealing to others. And about the sex, the urge or the interest in the sex, and then the personal relationship with others, and whether there is a decline in their day-to-day activity, and whether there are changes in their behavior. The next slide, please. Now it will be going to the informant, and the informant may say, we don't know, we see a sudden change. The patient stays aloof, the patient is irritable, he feels aggressive, he is not the original self which he was, and we don't know why this is happening. Next one, please. When it is a case of schizophrenia, the patient may say that at times I feel I'm talking to myself, at times I feel I'm laughing to myself. We need to be careful whether the patient is able to say this on his own. Sometimes the patient may say, I don't know, from nowhere I hear voices, even when I am staying alone. And he may feel suspicious about others. I feel others are looking at me. I feel somebody is tracking me. I feel somebody is doing black magic on me. And I feel somebody is controlling me with the help of a remote. It is all very new, this kind of feeling. It is very strange. I don't know whether I should tell it to my people, family people, members, or whether I should only come and tell to a medical person. And sometimes they say that I have a lack of interest. I don't feel like doing my job. I don't feel like feeling my profession. I used to love my profession, but now I don't have any interest. And they say, I don't even feel like grooming myself. I don't mind whether I'm presentable or not. And at times I get very irritable. I become very violent. And I do feel happy if I harm myself, cut my vein or something like that. And Sometimes they say the thoughts of suicide does come and it comes and takes my mind. I'm not sure whether I will be able to control that, or I fear whether I may attempt a suicide. And they say somebody is watching me through and through, even if I go to the restroom, and somebody is plotting to kill me. So this is a very strange feeling, and they will feel very delicate to come and confess or to discuss about this. The next one, please. When in case of depression, if the patient doesn't know that they are under a bout of depression, they'll only say that I feel there is a reduction in my activity. I'm not feeling brisk to do my work, and I don't feel like talking with others. I want to stay alone. At times, I feel like crying, not only once or twice a day, but quite a number of times. And I feel my eyes are welled up with tears, and the tears are coming from nowhere. And I don't know how much water I have in my tears, and all those things. And they say again, they will be expressing their death wish and guilty feeling, guilty for nothing at all. They feel guilty for all that has gone wrong in the family, whether they are the direct cause or whether they don't have any cause in that. And they are very apprehensive about the future, especially now during this corona period. All of them have their own doubts about the future, about their life, and especially and now we people staying in India have many of our roots in abroad. And so this anxiety, everything, and everything is there. Now going to the next slide. When it is a person with mania and when they don't know, they will say, I know I'm talking excessively these days. I'm not a person who talks usually this much. And I don't know from where I got the energy to do so much of work. Sometimes I don't even feel the need to sleep. I have so much of energy in me. From where did this come? I'm surprised. Though I am doing much work, more work than usual, than my regular work, I don't know from where I got this energy. I do feel that there is something different in me. And they say that they frequently feel like changing their dress, always see that they are dressing very neatly, they are grooming themselves very well. And at times they say, I feel I have a superpower in me, an extra power in me. How is it possible? And then they talk of wealthiness, richness, grandeur. And sometimes they say that they feel that they are God. So it is a strange feeling. I don't know what is going wrong with me. That will be the case of a mania patient expressing himself. In the next slide, when it is a delusional disorder, they will be very sure that something is happening and something is real, though it is not happening in real. But they will say that others are not believing them. They'll say that something is existing, but though it is not there, especially about the loyalty, the fidelity of the spouse. And they will say, I'm sure something is crawling all over my body, all over my head, and I'm not able to make my people at home understand. Please, you help me to make my people understand. So this will be the plight of a person suffering from a delusional disorder. Then coming to the psychotic symptoms, they say they are very sure about hearing voices, and they will even say, I'm sure it is a male voice commanding me to do this. And sometimes they will say, I hear it only on my right side of the ear, and sometimes it's only on the left side. And sometimes it will be in a very small squeaky voice or very in a whispers I hear. And they say, I do feel suspicious about others, but I can't say this to my family people or to the people. Supposing they are in a hostel, staying with their friends, or in a mansion, or whatever it is, they say, I feel I can trust these people, but I don't know, I'm feeling suspicious. So these are very sure psychotic symptoms, you can say. Next comes the neurotic symptoms. They say for no reason, I have a headache all through the time, and sometimes I feel vomiting. It's not, at times I don't vomit, I have the nausea feeling, and palpitations. My heart thrusting, I feel as though it will pop out. and it may come down, and then I feel chest pain. I have fear of death, thanatophobia, and I have fear to go to crowded places. Have fear to stay alone, and then I feel scared about the heights, and then they say I feel hypochondriacal. That is, I fear this will happen to me and that will happen to me, and this is more now during Corona period. And then repeated checking. I do lock my house. I do press the lock, or I'm sure I did it. But when I walk 2 steps away from it, I feel I have not done. So I go and check. It goes with ladies. I have switched off the gas and the kitchen, but I do feel I have not done that. Once in a while, if it happens, it's all right. But if it is repeated and if you're not feeling that comfortable without doing the rechecking, then it is a time for you to visit your mental health doctor. Okay. And then they do say that I do want to repeatedly wash my hands. I feel I'm not clean enough. Though I have thoroughly washed, I feel I need to. Obsessions, compulsions, everything. And repetition of thoughts. The something which has scared them once, it does come, and they are not able to put away with the thought, and they are not able to step out of it. So if these things are present, and then again the last one will be the multiple pains, that I have pain in my body, I have my pain everywhere. And if all these neurotic symptoms are there, you need to elicit from them. At times they will be giving a clear explanation about their status, but at times it is up to us to elicit from them. The next one, when it comes to the historical symptoms, you need to ask for whether there are instances of sudden fainting, or whether they are experiencing jerks, convulsions, or any such things. And sometimes they may go into mutism. They will never speak at any cost. It is selective mutism, whatever you may say, but if they decide not to speak, they will not speak. So at times they will be ready to tell and share with the when we are taking our history, but there will be moments when we have to probe and get these things. History taking is indeed a very beautiful experience, and though it consumes time, by the time you complete all the questions, it will be nearly 40 questions, and you may have to give around 45 minutes to 1 hour to get a beautiful explanation about the status you need to know. And the next the slide will be about the history of presenting illness. We need to ask them whether it was or whether the onset was sudden or gradual, on what the precipitating factors were, whether it was very acute, insidious, and you need to ask them, because they will not be able to tell it on their own, because they are confused with the state of mind they are. And so you need to ask for it, and you need to get it from them. And you need, the next slide will be about the history of presenting illness. Whether they had past medical history, we have to ask them. And about the past medicines they had been taking, the past consultations, and whether there was drug compliance, whether they were regular with the medicines, or whether they have stopped it on their own, and whether they have tapered and stopped it, or whether they have stopped it totally very abruptly. Just imagine a car or a vehicle going in full speed, and if you're applying the brakes, all of a sudden, what will happen? So you need to explain the state of affairs to the person as you are taking the history. And next comes the family history, pedigree chart, a genogram, whatever it is. The first square, it is, we have explained, represents the male, and the circle represents the female, that is the father and mother of a family. And then comes the siblings. And the person who is fully marked in red, he has a mental illness, but the person marked in red and with the arrow pointing to it is the person who is sitting right in front of you. In case if you feel confused drawing this diagram, you can just dark shade the person who is complaining, who is presenting with the illness. And if there is mental illness earlier in the family, you can, instead of shading it fully, you can put dots to fill the square or the circle. Next slide, please. When it comes to the personal life history, early childhood matters a lot. how the person was born, the developmental milestones, whether the person was born as a full-term baby or in an emergency, and then whether the milestone developments, the baby turning on their stomach and then the baby crawling, walking, talking, and all those things, whether the milestones had taken place at the proper time. And coming to the middle childhood, you need to ask about the person's friends when he in the society where he is in the neighborhood, as well as about his or her friends in school. Coming to the adolescence, you need to ask about the person's time during the time of puberty and whether there are any psychosexual history, and about the person's dating and peer relationship. Here we need to take very great importance. We need to attach about the peer relationship issues. And we need to ask about the school or college performance, because if there is an academic decline, we need to make note of it. And whether the person has been with substance abuse, has been using any say nicotine or alcohol or weeds, whatever it is, that has an effect on the mental status for certain. And then comes the next slide, early adulthood, about the marital issues or any other relationship. EMC, PMCs do come, extramarital contact or premarital contact, everything is there. And about the workplace history or work history, and about the recreations which the person is pursuing and his vocational pursuits as well, whether the person has a military history or whether the person has a prison history. It needs to be dealt with, because all this will cause a kind of pressure or stress on the person sitting before you. Coming to the middle and old adulthood, changing family constellation. There may be some changes where a lady or a person has to leave his or her own family and stay with a son's family or daughter's family for so many reasons. And that may have a pressure on the person. Next comes the retirement period, which is a very big wave of change in any person's life, because these days we are giving post-retirement, pre-retirement counseling and post-retirement counseling. We need to, and then we need to ask about the losses. Sometimes the person would have faced some business losses, and that needs to be taken into account. And in such cases, reality orientation will be very, very useful and helpful. And aging, the challenges that which comes with age is numerous, and you need to experience that to believe. And with aging, there are many issues, and nowadays, geriatric counseling and geriatric cases are on the rise. And be suspicious about everything, paranoid. And then there are persons who will be perfectionist, obsessive. They want everything to be on dot, on in its own place. Actually, a perfectionist will be happy, but the persons being with the perfectionist will really be paying a price for it. And historical, whether they were earlier, and whether they had any antisocial activities, whether they were involved in any such activities, and whether they were aggressive or whether they were cyclothymic. Sorry, the spelling is wrong for cyclothymic, and that is moving in between moods, where you're having mood swings. And the next slide, please. The next slide, please. Excuse me, sir. May I have the next slide? May I have the next slide, sir? I think there is some problem. Am I audible?
Yes, madam. Yes, madam. So
Can I go? Can I move on to the next slide, sir?
yeah. Please. It's going on. Yeah, we will go. Slide is going on, madam. I think you are not visible. Hello, madam. Are you visible? Is it visible for you? Madam, you are in mute. யாராவது கட் பண்ணி விடுங்க.
She left, she has to rejoin.
Yeah. So yes, sir. Madam, please join. Yeah, wait, sir.
Am I there, sir? Sir, can you hear me?
Yeah, yes, madam. Yeah,
Yeah. Can I have the slide, sir?
yeah, please.
Madam, please unmute yourself. You are muted.
Where is he? I think, dear participant, there is a kind of connectivity problem with Meera Ramesh. So just, I think that you had a very good session. Of course, only the last session we had some technical glitches, right? So I extremely sorry for that. So even in the beginning we had that technical issue, and even to the end, of course. But so far we didn't, face any this kind of technical issue. So kindly pardon us, dear participant. Please, I know that you are all very anxious, very eager to listen to all the people. Of course, we had successfully done, right, the 3 days online program. Right, I'm very happy that many of you have joined for this program, and she has also done a wonderful things. Even just to conclude my session, right? So we had two good speakers today. One by Dr. Kannan, who really did a wonderful job on the psychometric test. He has really touched upon the psychometric test, how the various tests he has just spoke about, the mental status, specific learning disabilities, then psychodiagnostic profile, and different types of tests, how that has to be done. So how it is being published. So he has also gone with the referencing. So it has to be in a APM model or MLA model, and more as many researchers, you know that we need to have a reliability and validity for the test, right? And he also expressed the importance of the review of literature. So through the review of literature, we were able to get a lot of information. Suppose even we can also construct our own scaling techniques for measuring our own clients. So that way the projective assessment. And he also touched upon the autism. So how we can able to measure the with cause and personality and interpersonal relationship, right? Because most of us, I think many counselors have joined, because you know that how we can able to use the 16 PF MBTI method, and also we can also try to measure the different kinds of measurement, like hope, happiness, resilience, quality of life, work-life balance. So and the intellectual and cognitive assessment also being touched upon by Dr. Kannan. And finally, with the history collections in patients, how the basic information and the demographic details that need to be collected. And she also very very sequentially she made how the cheap compliant can be made for the different diseases like schizophrenia, depression, mania, delusion disorders, then psychotic, neurotic symptoms, historical symptoms, history of presenting the present illness, the previous illness, and family history, personal life, pre-morbidity, personality. So all things that been very much covered. So right from the day one, that is on the first day, right? And I think Meera Ramesh was able to join right. So anyway, so thanks, madam. So I know that there might be always the technical issues will be there. So of course we cannot help it. Due to this, many times it happened. But I think as a Department of Social Work, dear participant, I wish to inform you that this is the 10th webinar, but we didn't experience such a kind of technical glitches, and this is the first time we are having this technical glitches. So kindly pardon us for that particular issue. So let me take the privilege of thanking all the resource person, starting from Mohammed Basha, who just touched upon the basics, scope and need for the counseling. And the second day, the second session by Guru Bharati, who really elucidated with the process in counseling, what are the different processes in the counseling. And the most important thing on the second day by Kadiravan, Professor Kadiravan, who just able to give a detailed a bird's eye view of the various the counseling theories, how the counseling theories can put into action. And the afternoon session we had by Catherine Barbas, working as a professor and a clinical psychologist from the Harvard University, and she touched upon what would be the challenges of a counselor, and especially the online counseling. You know that there is a difficult, and a telecounseling, of course, we do not have that kind of physical proximity will be losing. Of course, we mainly talk about the social distancing in this era of the COVID-19, how we are able to face the challenge. As a counselor, we try to face a lot of challenges, and today morning it was very crystal clear presentation by Professor Sai Kumar, and a consultant of psychotherapy, who just brought out the differences between the psychotherapy, counseling, and the social casework practice. So that the differences between, and the final session I told you that this is the thing. And as a counselor, we are dealing with the human being. So you all know that we are all dealing with the human being. I know that how sensitive we are, not dealing with the physical being, but we are dealing with the emotions of the people. So we are dealing with the emotions of the people. We are dealing with the psychological aspects of the people. So in this thing, you can, as a counselor, you have the role of transforming the life, bringing a changes in them. So with this plethora of information for the past 3 days, and you are the savior of this universe, or the nature. And let me just end up with a final note: the human being alone can lift another human being. So therefore, as a human being, as long as human being, we have a wonderful job to do for this country, and for this world, for this humankind. And therefore, as a counselor, we need to be, and during this pandemic or a crisis situation, how we are going to handle the people is very, very, vital for us. So take things seriously, and whatever things that is being imbibed by, or the plethora of information that is being given by the trainers, I think this messages has to be imbibed by each one of us, and try to embrace those things in your practices. So with these few words, I thank all the resource person and the participant who have been joined from almost 10 countries. They have joined, and almost 28 states, participants from 28 states who are able to join, and nearly, I think that 2,000 people across the globe has benefited out of this counseling program. And we are continue, because of you, we are trying to continuously having this webinar. And on the 3rd July, between 11 and 1 o'clock, we are also organizing another webinar on human trafficking and cyber security, with special reference to adolescent. I hope to meet you all at the same the platform, virtual platform. Of course, we all need to meet more socially or physically in the days to come, right? So thank you very much, the resource person, the participants, and every one of us. And I also thank my own colleagues in the department. I'm Senior Professor Dr. Ilango, Dr. Jerida and Anna Jeljo, Dr. Nirmala, Dr. Rajavel, and my own guest faculties in the department, Dr. Suresh Kumar and Dr. Karthigeyan. And of course, I think that you would have many times we have been uttering the name Dr. Selvamani and Milton, right? So those, and Leonie and Pugal Jyoti. So these are the people who have been tremendously working the technical team. So in spite of all the glitches we had, so they were able to resolve the technical issues. Even right now, they are able to resolve the technical issues. So I also thank my informatics center director, Dr. Parthasarathy, for giving enough room for us to telecast this particular program, broadcast this particular program, and the programming officer, Mr. Aroykya Raj, for his support for this online training program. I hope that you had a very fruitful and a very pleasant learning atmosphere here. So thank you one and all. Thank you very much.